Good morning, I'm Mabel Jong, and you're watching the World Healthcare Congress coverage, and we're here on day one of this event. And I'm so pleased to have with me in the studio Dr. Peter Angood, who is CEO, American Association for Physician Leadership. Dr. Angood, how are you doing?
I'm well, thank you for having me.
Well, it's been a year since we last checked in. Just wanted to get a view from you on how the progress is going now that we are 5 years into the passing of the ACA.
Sure.
Are you encouraged by what you're seeing?
Yeah, I am. Although the legislation is getting beat up still politically, I think the core of that legislation carries a lot of good messages. I think the healthcare industry is continuing to try to implement on those because at their base, it's all about trying to improve patient care through better access, more affordable care. And both the healthcare systems as well as the physician workforce are responding very well in terms of trying to shift into that from volume to value piece of it all, which is a big part of what the ACA was all about.
For sure. What are some of the tangible results that you find are lasting and really impactful on the sector now?
Yeah. Well, I think most importantly, people are understanding there's a clear shift into the value side of this equation. It's not a threat anymore. This is the real world. On the government side, at CMS level, that's being pushed harder. On the for-profit side and that payer community, that's getting pushed and the expectations are there. And the providers at the system as well as the individual level are all reacting in a positive way now and realizing, you know, this actually makes more sense. So there's different types of care practices coming into place. There's a heavier engagement of the physician workforce. There's the ongoing evolution of the multi-professional team-based care. So there's lots of positive things that are beginning to see and really demonstrate the tangible results.
Can we expand on that physician practices portion of what you just said? Are we seeing more innovative structures in terms of how physicians are getting together and really working out there with patients?
Well, you know, 5 years ago, the physician workforce was still a little bit kind of in mourning from the days gone by, but now they've really embraced the opportunities for innovation and at some levels even entrepreneurship. There is a background shift towards more and more employment of physicians, and that's both in the physician groups being fully employed as well as within healthcare systems. As those physicians get engaged, they get integrated, they get into leadership roles, that provides strong opportunity for innovative approaches. So we are seeing practice shifts, financial model shifts, as well as really an engagement overall of all of the different disciplines.
What about concentration shifts, specialty shifts? For years we've seen shortages in certain specialties versus others. Are you seeing any impact from the ACA on that area?
Well, that's a little bit slower because the educational system shifts more gradually. The healthcare delivery system is shifting very quick, but the education systems are gradually coming into place. Each of the new medical schools that are coming online are spending a lot of their focus on primary care, and that's the glue. Primary care is the glue in terms of what's going to hold population health together as well as the ongoing implementation of the ACA. So that's an important focus. What we're also seeing is in spite of where that slow shift on the education systems are, is there's a groundswell of activity from the medical students and the trainees and the early careerists to really make special efforts to learn management skills, leadership education, and really recognize how can they contribute better in order to create a better healthcare system overall. So they're moving ahead in terms of just trying to create better care just by their own initiative.
And are you also seeing more physicians taking a more local approach to care and maybe speaking up more if they're seeing that there are changes in the system that they're not really approving of or supporting?
Yeah, I think they're doing it in a much more constructive way. You know, historically the physician workforce, if anything, was a little bit guilty of complaining and sort of, you know, criticizing because it was impacting their world. But that's flipped all the way around now, and so the constructive criticism that's evolving is all really designed to really improve healthcare as opposed to improve the environments of the physician workforce. And that's a significantly important shift. So yeah, physicians are getting engaged at all levels, local, regional, state, as well as at the national level in constructive ways.
All right, Dr. Angood, it's always great to see you. Thank you
for
your time.
Oh, thank you for the opportunity.
And I'm Mabel Jong. Thanks for watching.